Insertion of an object, penis, or finger into the vagina is part of the sexual experience of many women. However, between 8 and 22% of women worldwide experience pain when they engage in this type of sexual activity. This can have significant negative effects on their sexual satisfaction and on their quality of life. From a clinician's perspective, assessing a patient's sexual pain is really important for leading them to different diagnoses and treatment plans that will ultimately help their patients. But despite this symptom being so important, it has been famously termed the neglected symptom in healthcare. Why? Oftentimes, both patients and clinicians can feel embarrassed when talking about sex and sexual pain, which doesn't make it easy for the patient to talk about it, and it doesn't make it easy for the clinician to treat it. So I started to think of ways of easing this communication, something that could make this conversation a little bit more accessible. I found that there were currently no tools available that could do this. So my thesis project aims to use both patient and clinician collaboration to create a questionnaire that captures the whole picture of sexual pain, including everything that a patient would want to tell their clinician and everything that a clinician wants to know from their patient. I created the questions for this questionnaire using prior research, and then I brought together a team of patients, researchers, gynecologists, and psychiatrists, and had them revise all of the questions that I made and add in any new questions that they thought were missing. By collaborating with this diverse team, I was able to make sure that the questions were relevant for both the patient and the clinician. Not only did I create questions related to the physical characteristics of someone's pain, or things like the location, timing, intensity, and quality, I also created questions relating to how does pain affect someone's behaviors, thought processes, feelings, and sexuality. And then I tested the questionnaire by running individual interviews and focus groups with 18 patients who were currently living with sexual pain. And the results were very positive. Patients found the questionnaire to be sensitive to their experience, comprehensive, relevant, understandable, and appropriately formatted. And in the future, I'll be conducting further testing to check this measure's validity and its reliability. Overall, this project used both patient and clinician collaboration to create a health tool that is useful for all parties. It can now be used to gain a deeper understanding of a patient's sexual pain that might not have otherwise happened. I hope this presentation has shown you how valuable it is to be collaborating with patients in the area of healthcare and health research, and maybe even prompt you to have a conversation with your clinician about sexual health. Thank you.